This is presentation of the case with single position lateral L5-S1 anterior lumbar interbody fusion combined with posterior percutaneous reduction of spondylolisthesis. The patient is 68-year-old male who presented with history of progressive low back pain for many years. His symptoms were associated with bilateral leg pain and neurogenic claudications in L5 dermatomal distribution, worse with walking and sitting. His symptoms improved with rest and laying down. At the time of presentation, patient was unable to walk more than 20 steps without stopping due to severity of his symptoms. Patient underwent extensive conservative management which included physical therapy, epidural steroid injections, non-steroidal anti-inflammatory medications. Initially, conservative management was effective. However, as symptoms progressed over time, conservative management did not provide adequate relief. This is supine MRI which shows grade 1 L5-S1 spondylolisthesis on the sagittal projection. Axial views reveal significant facet diastasis and arthropathy, which indirectly indicate mobile spondylolisthesis. Standing radiographs reveal worsening of spondylolisthesis and no significant scoliosis. Lateral views of lumbar spine CT redemonstrate L5-S1 spondylolisthesis. Patient failed conservative management and his symptoms were progressively worsened with significant limitation of daily life and performance. Therefore, surgical treatment was elected. For this patient, we implemented single-position lateral L5-S1 anterior lumbar interbody fusion, followed by posterior percutaneous L5-S1 screw placement and reduction of spondylolisthesis. The advantage of utilizing single-position surgery is to eliminate repositioning with potential to minimize the operating room and anesthesia time. These are intraoperative radiographs that show positioning of navigated percutaneous screws at L5 and S1 levels. After this portion of the operation, the anterior lumbar interbody instrumentation in a lateral position was performed. This is lateral intraoperative fluoroscopy image that demonstrates placement of L5-S1 cage with one anchoring screw into L5 vertebral body. Placement of only one anchoring screw allows for mobility and possibility to reduce spondylolisthesis with posterior instrumentation. Once the anterior lumbar interbody cage was placed, the attention was again turned to the posterior instrumentation. The rod was placed into the screw heads. The rod was initially locked into the S1 screw head. This is demonstrated in lateral left radiograph on this slide. Next, reduction of spondylolisthesis performed by sequential tightening of the rod into screw head of L5. This is demonstrated on the right-sided radiograph on this slide. This is final intraoperative image with all hardware in place and spondylolisthesis reduced. Postoperative CT demonstrates correct positioning of hardware and reduction of spondylolisthesis. Postoperative MRI demonstrates decompression of bilateral L5-S1 foramina as well as reduction of spondylolisthesis. Postoperative standing radiographs reveal good spinal alignment without significant scoliosis with correct positioning of hardware. Patient had immediate resolution of back pain and neurogenic claudications immediately after surgery. Patient was discharged home on postoperative day 2 with minimal pain.